Hello, I'm Dr. Charles Brady, a clinical psychologist who has had the honor of treating folks with anxiety disorders for over 30 years. And I'm glad you're joining me, as I hope that by the end of the presentation, you will understand a little bit more about the nature of anxiety, how it presents as a disorder, how we treat it, but also how you can be as supportive as you can to those in your lives who may be suffering from one of these anxiety conditions. So we will first start with an overview of what anxiety is, talk about the diagnoses, the treatment, and then the roles that you can play in your loved one's life to help them recover. So let's talk about what anxiety is. Before we talk about it as a disorder, there are three roles that anxiety plays for human beings. There are actually a few more, but these are the three main ones I'll introduce. It can be a happiness booster, kind of also a personal development coach, or you could also call it an unattractive lifeguard. And I'll break these down and describe what we mean by all of those. So if I asked you, would you like a life without anxiety? Most people reflexively answer, sure, that sounds wonderful. But if you really look at some of the happiest events in your life, whether it was when you got that new job that you were so excited for, or the birth of your first child, or perhaps when you asked your partner to marry you, all of those were preceded by anxiety. There was uncertainty. You didn't know what they would say. Would they say yes? Would the wonderful thing happen? Would my child be born healthy? And what will that be like? Now, if we did not have that anxiety beforehand, in other words, if we knew exactly what the outcome would be, we wouldn't have the same happiness. Now, think about what happens with video games. What happens once you master a level of a video game and then ultimately master the video game itself? We tend to lose interest. We don't have that excitement. We don't have that anxious feeling that goes along with playing the game, wondering whether we'll make it to the end and succeed. So if we removed life's anxiety from our experience, we'd actually be sucking a lot of the potential for joy and happiness that goes with it. So the next role that anxiety plays for us human beings is it can serve as somewhat of a personal development coach. Now think about times when you're trying to accomplish something that's very challenging. Maybe you have final exams coming up and you're worried about whether or not you've learned all the material from your American history class sufficiently. And that anxiety drives you. It drives you to study. It drives you to prepare. You don't want to get a bad grade. That anxiety can act as a fuel. Or whether you're training to run a marathon and you're worried about staying on your training regimen. Am I going to make it? Well, those uncomfortable feelings don't necessarily hurt our performance. They're not comfortable, but they can actually serve as a type of motivation. Now think about the person who's studying. When we get anxious, we actually have adrenaline running in the body that can help us focus and perform better often than when we don't have anxiety. There have been many studies over the years that actually show with anxiety in test taking that those individuals who have at least moderate anxiety before taking a test do better than those with too little. Let me break this down a little bit further. There's something we call the Yerkes-Dodson law, and this is something that has been around for decades. It's been studied many, many times. And what we realize that in tasks that are at least moderately challenging, the optimal level of anxiety to have is a moderate level. Now, so if you think going into a job interview, that's a situation that is moderately difficult. You don't know what they're going to ask. Are my answers going to be sufficient? We know that when people have moderate levels of anxiety going to job interviews, they will more likely perform better. Sometimes I joke that if I was having to undergo surgery, the last thing I want to hear from my surgeon is that they have no anxiety at all when they operate. Actually, I want them having some. I want them to be a little focused. I want them to realize I'm a real human being. Even though the anxiety is uncomfortable, it can actually improve our performance, and it usually does. Now, quite clearly, if you have debilitating anxiety that makes your hands shake and your anxiety is off the charts, then that can actually start to decrease in performance. Likewise, if you have too little anxiety, think about the job interview example. You go into the job interview, you have no anxiety at all, well, you might go in underprepared. They might ask you a question and you might not be thinking of three possible answers. It may take you a little while to come up with an answer. And so your performance can actually be negatively impacted by too little anxiety. So even though anxiety is uncomfortable, it's not always dangerous. It can actually boost our performance in many, many situations. Okay. Likewise, well, what do I mean as an unattractive lifeguard? Well, what we mean by that is when we feel anxiety, it tends to get our attention. It creates distress. So imagine you're walking down a street at night and you see three individuals walking on the same side of the sidewalk. Maybe they're about 2 blocks away, and you can see they're holding knives. Well, at that point, you should not be comfortable. Your anxiety is going to alert you to do something. Cross the street, turn around, take your cell phone out. That discomfort is there for a purpose. It helps alert us to dangerous situations so we can take appropriate action. So let's talk a little bit about under the surface with the neurobiology of anxiety. What is actually happening when we experience anxiety? Well, first thing to realize, as we mentioned with the unattractive lifeguard, anxiety is part of the body's stress response. Now, there's something we call the fight, flight, or freeze response. When that is triggered, the body is flooded with both norepinephrine and cortisol. And let me talk about what that fight, flight, or freeze response is. When we face a life-threatening danger, if a tiger comes in the room during this presentation, I should not feel comfortable. My mind will scream at me, do something, run, or fight. Sometimes before we know what the appropriate answer is, we freeze, trying to figure out, is this a situation that I should run from? Or is this a situation I should fight? So we talk about the fight, flight, or freeze response. And what's happening is the body's being flooded with these neurotransmitters and these hormones that are getting it prepared to take drastic and immediate action. They help boost our perception, our reflexes become sharper, and we can act more quickly and forcefully in dangerous situations. It's very adaptive. It has helped us survive over the eons. We call this sympathetic arousal. Now, that's the same sort of arousal that you have if you take too much Sudafed, for instance. But what ends up happening is that sympathetic arousal, when it spills that norepinephrine, that cortisol, our body is feeling activated. It's telling us, do something, do something. And that spurs us into action when we have anxiety. So let's talk about the transition from anxiety, which we all experience as humans, to how does it become an anxiety disorder? So first, our fight or flight system gets activated in the absence of a life-threatening danger. Think about it. It starts to have false alarms. So instead of feeling extremely uncomfortable because a tiger is coming in the room, I start to feel that same discomfort if you put a microphone in front of me and ask me to speak to a large audience. Again, it's not life-threatening, but the fight or flight system may get activated. And what we see with the level of fear, it's out of proportion. The threat, think about speaking in front of an audience. Unless you're speaking in front of an audience of cannibals, that fight or flight response is way out of proportion for actually what could happen. And over time, what starts to happen is everyday occurrences start to become overwhelming. The person starts to have fears of talking in large groups and maybe small groups, maybe even holding conversations becomes extremely burdensome. And so what happens? We, since it becomes so burdensome, becomes so painful actually, the individual starts to avoid. They start to use escape behaviors. Now they avoid going out, they avoid talking to strangers, they avoid talking in large groups. Or if they're in a group, they might look for a way out so that they can leave. And these behaviors start to interfere with their daily functioning. So those are the things that happen that make anxiety transition from just human anxiety to an anxiety disorder. So let's look at it from learning theory. So let me break this down. What happens with anxiety? Well, there's a trigger, and that trigger can be internal or external. An internal trigger can be a thought. Now, it can be a person driving to work and all of a sudden they have a thought pop up in their mind. What if I left my front door unlocked? It can be external. A person can be walking down the hall and someone sneezes, and that sneeze triggers an anxiety response. Well, how does it do it? Because the person has a thought. So for the person driving to work, what if I left my front door unlocked? Well, it's not just that thought, but they have a negative appraisal of that thought, which means they start to think that might be true. That could have happened. Or for the person walking down the hall and someone sneezes, instead of just thinking, well, that person sneezed, they might think, uh-oh, what if I just picked up a terrible, horrible illness? And so it's not just having the negative thought that lands, but the person has to think of that thought in a way that amplifies it, that makes it seem even more negative, more ominous, more dangerous than it actually is. So what happens once they make that appraisal of that thought? They feel pain, they feel distress. The body says, do something, get me out of here, help keep me safe. And so as a result of that, a person will perform a neutralizing response. They will do something to reduce the distress. Maybe the person who's driving to work turns their car around and goes home to check their front door. Maybe the person who was sneezed on ducks into the nearest restroom and washes their face and hands. And what ends up happening is they feel some immediate relief, but that relief is short term because what that does, it signals the mind to think of those triggers as really important. It's almost as if the person says, whew, dodged a bullet. I'm glad I thought of a way out of that. But what happens, they become even more vigilant, more wary of those triggers. And so they start to become more sensitive when they're around those triggers in the future. And so you can see the cycle starts to grow on itself. Trigger, negative appraisal, distress, neutralizing, and it repeats the cycle. So what are some typical symptoms of anxiety? These are things that happen with sympathetic arousal. Heart rate increases, perspiration, short, shallow, and rapid breathing. The person may tremble. They may have upset stomach. They may feel their bowels start to feel loose. There might be some tearfulness, numbing, tingling. Sometimes what we call depersonalization, the sense that what's going on around me just doesn't feel real. They could have fears of dying. Oh no, my heart is beating so quickly, I might have a heart attack, or I might lose control. If I get anxious, what happens if I panic while I'm driving? They may become more irritable, and they may develop fears that these feelings will never go away. So let's now walk through what we mean by diagnosed anxiety conditions. I'm going to talk about 4 anxiety disorders, generalized anxiety disorders, what we call specific phobias or single phobias, social anxiety disorder, and panic disorder. I will also touch briefly on 2 disorders that, even though they don't fall directly under the anxiety disorder umbrella in our diagnostic manual, they are very much chock full of anxious experience. And those are obsessive compulsive disorder and post-traumatic stress disorder, OCD and PTSD. So one thing to remember as we go through these slides, I think it's helpful to understand that anxiety disorders actually are very similar to each other. The way that they differ from each other are based on two things. They're based on the triggers and they're based on what neutralizing response tends to happen. And for consistency's sake, as we go through the slides, you'll notice in the red ink, those will be the triggers for the anxiety disorders that I talk about. And what's written in the light blue, those will be the varied neutralizing responses that we typically see within each of the anxiety disorders that I'll present. So let's start first with OCD, obsessive compulsive disorder. Though it's technically not an anxiety disorder, it's classified a little differently. It follows a lot of the rules that anxiety disorders follow. And we know that it responds to treatment extremely well. So what is it? Well, when someone has uncontrollable, intrusive, recurrent thoughts and compulsive behaviors that they must repeat over time. Okay, that's a wordy phrase. So what does that mean? Well, let's start with obsessions. What are obsessions? Okay, obsessions are the trigger. Intrusive thoughts, images, or urges that increase anxiety and distress. So a person could have an intrusive thought of, what if I touch that doorknob and I get hepatitis C? Or they might have an intrusive thought. And what we mean by intrusive is it's a sudden, unwanted thought that goes against their principles. They don't want these. These don't match who they are. So you could have the young mother who has the thought pop into her mind, what if I harm my young baby? You know, I have an urge that I won't be able to control. So these can be thoughts, images, or urges. So that triggers the distress. So what does the person do? They perform compulsions. These are behaviors. You know, they can be external, internal. So a person who might have OCD focused on germs may wash their hands a lot. A person who is worried about, let's use the example of the mother who's maybe worried about harming her baby. Well, she may develop an internal compulsion of saying over and over in her mind, I'm a good mother, I'm a good mother, I'm a good mother. And maybe she says that 7 times and she feels a little bit more at peace. These are all done to reduce the anxious experience. But what happens? These compulsions start to take more and more time. The anxiety creates more distress. They may even start avoiding things to neutralize it, going places, engaging in activities. And so what ends up happening? Their everyday functioning becomes impaired. So just a few examples, you know, obsessions on the trigger sides. It could be contamination, fear of germs, fear of blood contamination, fear of chemical contamination. We also have what we call morbid obsessions, which can include, you know, what if I have an urge to hurt someone? Or sometimes you'll see, what if I have an urge to hurt myself? And again, these are what we call ego dystonic. The people who are experiencing these don't want these to happen. They're repulsed by these thoughts, but they're still scared by them nonetheless because they feel so frightening. Compulsions, again, there's a long list, and neither of these boxes are entirely inclusive. Could go on for hours listing all the possible obsessions and compulsions there are. But you can have washing and cleaning, you know, 2 to 3 hour showers, washing your hands 10, 15 minutes each time that you wash them, and maybe watching them 15 times, 20 times, 30 times a day, checking doors, locks, and stoves. Many, many things, having special numbers or phrases that a person repeats in their mind over and over again. It's one we call mental review, where a person, maybe they worried that they said something obscene during a party they attended the night before. They might review the scene in their head over and over, trying to gain the certainty to make sure that they didn't say anything. Or they may seek reassurance and ask people who were at the party, did I say anything offensive? So just some examples of obsessions and compulsions. but let's go ahead and move forward. Okay, close cousin to OCD is generalized anxiety disorder. Now, generalized anxiety disorder, what we mean by that, it's excessive and ongoing worrying. So in this one, worrying is actually the neutralizer. And this happens nearly every day, and it tends to cover several topics. They may include finances, family health. Am I going to lose my job? Do I have enough for retirement? Will my kids, find a life partner? Just goes on and on, kind of like a gerbil on the wheel. Person can feel edgy or restless. They feel tired because their brain is working overtime. They have difficulty concentrating on other things because they're spending so much internal energy on what they're worried about. They can be irritable. Muscle aches or soreness are common. And difficulty sleeping is a huge, very common factor. Sometimes people get OCD and generalized anxiety confused. One of the things that I try to illustrate to help folks understand the difference, an obsession strikes like lightning. Usually starts with two little words. What if? What if there are germs on that doorknob? And it jolts the person like a lightning bolt. In generalized anxiety disorder, what the person worries about, those fears, they're more like a distant rumbling thunder that feels like it's always there and always distracting them. And what are they trying to do? The worry is their attempt to try to solve a problem. The only challenge is the things that it tends to worry about, that are worried about in generalized anxiety disorder, usually don't have answers. How can I know for sure that I will have enough money for retirement? We can't know the future for sure. And so that uncertainty is so difficult to tolerate, but people's tendency is if I can just think about it enough, maybe I can keep the bad things from happening and things will be okay. So specific phobia. These are fears of spiders, fears of heights, fears of syringes, so many of them that are out there. These are persistent fears of particular objects or situations. And what is the most common neutralizing action? Tends to be avoidance. And these avoidances start to interfere with normal living. So, for instance, a person who lives in the Midwest who has this phobia about thunderstorms and they won't leave the house when a thunderstorm is predicted, well, they may end up losing their job or getting poor grades in school because they're missing too many lectures. So these are very straightforward. Person comes across the object, spider, they're up on a ladder or on a skyscraper, 10-story building, and they have the fear. Usually they'll try to avoid it, but if they can't avoid it, well, then they will use an escape behavior. If they're up on that tall building, they will get to the lobby as quickly as possible. If there's a spider in the room, they will get out of the room as quickly as possible. So those are some things that you will see commonly with what we call specific phobias. Social anxiety disorder, very common anxiety disorder. And the way we describe it, it's a persistent fear of social or performance situations. So it can be something that plagues actors, musicians, people who have to perform in public. But it can also be found in individuals who are afraid that others will think negatively of them. And so they're afraid to talk to strangers. They're afraid to talk to coworkers. They're afraid to say anything in a group. So it doesn't have to be just the performers, but individuals who are afraid that if I say something, I'm going to embarrass myself. People will think negatively of me. They may reject me. They may criticize me. And what are the neutralizations? Well, the two most common ones we run across are either avoidance, they'll start to avoid those situations, or they'll try to be perfect. So they'll overperform, over rehearse. Okay, I'm going to go to that group tonight. I'm going to meet some new people at church, and they may rehearse their opening introduction for a half hour before they get out the door so that they can feel that they'll have it perfect before they show up at the social meeting. Panic disorder. Okay, triggers for panic attacks include being away from safe places. What's one of the most common safe places for people? Their home. And the physical sensations that have been associated with these past panic experience. So what happens in panic disorder, a person has an overwhelming sense of panic where they may feel dizzy. They start to breathe very rapidly and shallowly. Their chest may start to hurt. Their pulse quickens. They can have the numbness. Their eyes will dilate. Now they have a huge spike of fear. And what ends up happening is they start to become afraid of these attacks. They become afraid even of some of those physical sensations to the point where some people will say, I don't even exercise anymore because I don't like to get my heart rate up because that almost makes it feels like one of those panic attacks I had. And so they become so afraid of the panic attacks because they misinterpret them. They think that having one means that I'm going to die or lose my mind. And so what they will do anything they can do to prevent them from happening, which usually includes a lot of avoidance. They go out less. We see a lot of what we call agoraphobia, where people stay in their safe spots, they stay home, or if they're in a situation, they'll escape. I don't know if you've ever been in a large supermarket and you've seen an abandoned shopping cart that the groceries are there, it's in the middle of the aisle and no one's there and no one comes back to claim it the whole time that you're in the store. Well, it wouldn't surprise me that most of those times that the person may have had a panic attack in the supermarket and they decided that they had to leave immediately, even before checking out with their items. It's a very, very common disorder, very treatable, but it's one that can create a great bit of debilitation, and you can imagine how it can interfere with a person's life as you start to avoid things more and you just can't get those things or enjoy the situations and experiences that you used to. So let's talk briefly about post-traumatic disorder. So these symptoms develop after experiencing or witnessing a terrifying, typically life-threatening event. The symptoms may include, and these symptoms are also triggers for it also, the nightmares, flashbacks, re-experiencing the traumatic experience, including unwanted memories coming back in. So what does a person typically do to try to manage it? Well, they start to avoid the situations that will trigger memories of it. Now they develop what we see as a hide and startle response. Someone drops a book in the room. You may see this person leap into the air. They have depressed mood, overbearing anxiety, symptoms that can make life very, very difficult to manage. Okay, so that's just a brief introduction to the anxiety disorders as well as OCD and PTSD. Let's talk about treatment. So there are two roads for treatment for anxiety. We have medication and psychotherapy. So we will spend most of the time talking about the psychotherapy approaches. I'm a trained clinical psychologist. I'm not a psychiatrist, so I won't do a deep dive in the medication. But I think it is very useful to talk about what is the role of medication in treating anxiety to help you understand what we're attempting to do when we use medication for anxiety. So what I like to say is we like to think about anxiety as a storm. And let's say you were going to try to learn how to sail a boat. You wanted to take up sailing. Well, I hope your sailing instructor does not take you out in the middle of the ocean during a northeaster to learn to sail. You would not be able to focus. To learn how to sail, there's a lot to learn. How do I sail into the wind? What are all these lines for on the boat? Now, which way does the tiller need to be positioned? Lots of things to learn and to understand. But if you're also in the middle of a raging ocean storm, it's very hard to learn. So what medication does, it quiets the waters. It's kind of as if that sailing instructor says, okay, we're not going out in the ocean first. We're going to go on a lake or maybe a nice quiet bay. so you can learn the fundamentals of sailing, so you can learn how to master that boat. Water kicks up, and having that confidence is actually going to help prevent the water from kicking up and the storms from getting too bad. What we do know from decades of research is that when you combine medication with psychotherapy, it can lead to faster results. Also, less chance of relapse. There have been many studies comparing medication to psychotherapy, and all the studies show that both are helpful. But what they also point to is that if a person is only treated with medication and doesn't undertake the psychotherapy approach, that the chance of relapse once they stop the medication is extraordinarily high. But we find when people engage in psychotherapy with or without medication, that when they have success and they manage their anxiety to the degree that they want, if they then decide with their doctor that they want to come off the medication or reduce it, they are much more likely to succeed without relapse. Right, so let's talk about several of the treatments psychotherapeutically that are offered for anxiety disorders as well as OCD and PTSD. There are others, but I just want to start with these as the probably strongest evidence-based practices for these conditions. So I will go through the list of cognitive behavioral therapy, exposure and response prevention, acceptance and commitment therapy, ACT, cognitive processing therapy, CPT, DBT, which is dialectical behavior therapy, and finally, emotion-focused family therapy. So cognitive behavioral therapy. Well, what we know is that when someone is struggling with anxiety, they are having disruptions in all three of these, in their thoughts, in their feelings, and their behavior. And with cognitive behavioral therapy, what we're trying to do is we're trying to make changes in either the thoughts or the behavior. And some people are under the mistaken assumption that, oh, we're changing thoughts. And that's partly true. But when you think about what's going on in cognitive behavioral therapy, we're actually establishing a different relationship with the troubling thoughts that have been creating the anxiety. We never really have the ability to stop thoughts entering our head. But remember when I talked about that negative appraisal? We can change the appraisal. We can start to understand these thoughts might be annoying. I might not like these thoughts. They might smell bad, but I start understanding these thoughts really aren't dangerous. Well, that's going to lead to changes in feelings. Likewise, if we make changes in behavior, if we have a person neutralizing less, avoiding things less, the person with panic disorder, if we have them going out in public more, they start to learn that, okay, being out in public isn't as dangerous, and their thoughts start to be modified. They have a different relationship with that thought of, I might have terrible anxiety in public. They start to learn that it's not as bad as I thought. So the relationship changes. And what you'll see in these next therapies, if you really want to zoom out, the rest of them that I will be talking about, they are all under the umbrella of cognitive behavioral therapy. And so many of them called second or third generation cognitive behavioral therapies. But let me walk you through each one and describe what we experience with them. Oh, but before I do that, let me point to this slide. So let's talk about what's happening when someone recovers from anxiety. So you'll see, and this is the premise for all cognitive behavioral therapy and really for almost all psychotherapies that we use to treat anxiety. So the person has the initial fear trigger. So what do we mean by that? So let's use OCD as an example. The person walking down the hall, someone coughs. That's the trigger. So what is the neutralizing response? They duck into the restroom, They wash their face and hands with soap and water for 20 minutes. And what does that reinforce inside the mind? Well, that reinforces the belief that I can't handle this without neutralizing. And so that goes on and on and on. But on the right side is what, with therapeutic interventions, this is what we're aiming for. We have the original fear trigger. Say the person walks down the hall, person sneezes, but we encourage them, okay, let's neutralize less. Let's reduce or eliminate it. And so maybe they start out by going into the restroom, but instead of washing their face and hands for 20 minutes, maybe they do it for 5 minutes. And they continue to do it in the future for 5 minutes or less, gradually to the point where we're encouraging them to learn that, oh, I don't have to run into the restroom at all. Well, what that starts to change is the underlying belief that I can't handle it without neutralizing to the new positive belief, oh, I guess I can handle this without having to neutralize the way that I used to. Because it's that neutralizing that fuels the anxiety's life. If we cut off its fuel, reduce its fuel, anxiety doesn't have much chance to survive. It needs the neutralizing in order to stay strong and in charge of a person's life. Now I'll get into each one. Exposure and response prevention. So what is exposure? Well, this is where we purposely touch yucky things and think yucky thoughts. You purposely confront and maintain contact with feared objects, thoughts, or images. We're going on the offense. We're doing this stuff on purpose. But exposure without response prevention. What is response prevention? Well, that's where we start to put the neutralizing on an allowance. We start to ration it. We start to weaken it. We start to fade it, ultimately eliminating the neutralizing actions. And it's that 1-2 punch, both going on offense and defense, that helps the person recover, actually helps their brain recalibrate itself so it's less sensitive to those triggers. So in exposure and response prevention, we safely increase exposure to the situations that create the distress. So we actually get the persons starting to touch doorknobs. We actually get the mother who's afraid of harming their child. We actually, encourage her to, no, don't change your plans. Prepare dinner and chop the salad even with your baby in the high chair. The OCD does not want them to do that. But what they do is they deliberately expose themselves to those triggers by participating in real life experiences under the controlled conditions. So as a therapist, I may be going up and down the halls encouraging my client to touch doorknobs. I may actually have them cutting carrots in my office. We will be doing whatever we need to do to get the OCD's attention. We actually want the person to feel some of that distress in a very strategic way, and then they can learn that I can feel the distress, not do anything to neutralize it, and it subsides on its own without me doing anything. I like to say with anxiety disorders, particularly OCD, we like to have people getting lazy in a healthy way. The kind of less is more. The less you neutralize, the more health you get. So ACT, acceptance and commitment therapy. So this involves several facets, mindfulness, learning to observe the thoughts in one's mind. Also being able, what we call the observing self, being able to look at one's thoughts, let's imagine the thoughts as a cloud, but I am the permanent sky. The clouds will change, my thoughts will change and travel, but I still have who I am, observing my thoughts. Acceptance and willingness, acceptance that I might have to give a speech in public, and I'm going to accept that I'm going to be uncomfortable while I'm doing it, but I really want to succeed at my job. So I'm going to accept the discomfort and be willing to give the speech and allow that comfort to show up if it chooses to. Diffusion, learning that a thought is not a fact, that I have thoughts, I can observe them, I don't have to, if you want to say, kind of weld with them. become one with them. I can look at them as objects or things that pass through my experience. And the last two, values and action. We want people to do what we call value-oriented action. Keep doing those actions that move you towards your values. This is how people recover. Let me get away from the conceptual here and let me use a metaphor to help illustrate what we mean by act. One of my favorites is what I call monsters on the boat. So imagine life is like this great sailboat race. If you haven't picked up on, well, I enjoy sailboats, so you might hear me give stories of them later on too. So you start out in your sailboat and you know your destination. You want to go to this beautiful paradise island. So you start sailing, and everyone is sailing to their own paradise island. And you're making pretty good progress. And all of a sudden, up from the hull of the boat comes these monsters, gnarling teeth, gnashing, and they look evil. And you're terrified. And you're frightened. You don't know what to do. They're too big to push overboard. So out of desperation, you lower your sail, and the boat comes to a stop. Well, the monsters go below decks. They're still down there, but it's not as terrifying. Well, after 3 days of floating in the ocean going nowhere, you decide, I need to get back. I want to get to my island. So you raise the sail again, and the monsters come up. Aggravating. So you decide, okay, I've got to lower the sail. And this goes on and on, hundreds of times. And you see everyone else getting closer to their island, getting to where they want to be in life. And you're no closer than you were for the last 5 months. So out of desperation, you realize you haven't been eaten yet. So you decide, I'm going to raise the sail and I'm going to tack the halyard to the mast so I can't even lower it. So you do that, the boat starts taking off. You start making progress. And not surprisingly, the monsters come back up. And they're there day after day. The boat is sailing, it's making progress, but those horrible monsters are there. But what you start to notice after a few weeks, hey, the monsters don't look as big. There actually seem to be less of them. They don't seem as loud. Until finally, months later, you're making more progress and they don't come up every day. They come up sometimes, you don't like them, but you keep focused on making progress and it's as if you barely notice them in the boat. Those monsters are those intrusive thoughts, those yucky, anxious thoughts that we have. We accept them, accept that they're going to be there. We don't have to outlaw them. But what we focus on are our value-oriented actions. My value is to get to that island, to get that thing in life I want more than anything else. And if I'm going to feel anxious part of the way, I'm going to allow that. Um, so I'm not doing any neutralizing. I'm allowing the thoughts to be there. I'm allowing the feelings to be there. In a sense, quote, I'm getting lazy. I'm not doing anything except focusing on my values and making those committed actions. So that's what acceptance and commitment. We're committing to those values. Cognitive processing therapy. This is a very specific type of therapy designed in particular for PTSD. Very helpful. It's a very evidence-based practice that has helped many people recover from OCD and lessen their symptoms and increase their engagement in life. So it has four components. One is helping the person suffering PTSD understanding what their PTSD symptoms are and what their function is. Take the mystery out of them. Also helps them increase their awareness of their feelings. They don't have to run from the feelings. They can be more aware of them. They can allow them. And then in a very cognitive behavioral therapy fashion, we work on changing and challenging the maladaptive thoughts. Again, that negative appraisal of these thoughts. We have them adapting so that the thoughts that they had that were fueling the PTSD become less potent. Then we work on specific areas, changing their PTSD beliefs about what is safety, trust, power and control, esteem and intimacy, all factors that are super common and oftentimes thrown out of kilter with a person who's struggling with PTSD. Okay, DBT, dialectical behavior therapy, is a skills-based therapy. Oftentimes it's administered in groups, but it can also be done individually. And it focuses on 4 learning modules. One is mindfulness. If you remember, we saw that in ACT, learning how thoughts can just be thoughts. They don't have to be reality. If we just let them be, they will float by us. So that's one component. Then we talk about distress tolerance. Okay, when I'm experiencing distress, how do I learn to tolerate it more? How do I build up willingness to allow it to be there? A lot of different skills engaged in that. Also, emotional regulation. People with severe anxiety, many times they become what we call dysregulated, um, known on the street as freaking out. That's emotional dysregulation. The person, in a sense, is so overwhelmed in a spike of anxiety that they're not thinking clearly. They're not thinking like themselves. So we teach them skills how to regulate their emotional experience so they're not pushed around by their anxiety during the middle of an anxiety spike. The fourth component is interpersonal effectiveness. Individuals in DBT learn how to get their needs met more effectively, how to be more effective in asking for help, how to engage with others in ways that reduce some of the triggers that often they face in their interpersonal relationships. So it's very skills focused. There are homework, there are worksheets. It's not something that you sit on the couch and just look at the ceiling and say what comes to your mind. In a sense, it feels like going to school because it's very, very skills focused. The last one I'll talk briefly about is emotion-focused family therapy. And this one just doesn't engage the individual suffering the anxiety disorder. This engages the whole family. We're helping them develop how to be emotionally supportive, behaviorally supportive, how to help heal wounds that may have been nested within the family experience that has contributed to the person's anxiety, and also helping the individual overcome any blocks to their emotional blocks. It's a very empowering, not just for the patient, but empowering the people who are most important to the individual suffering anxiety, empowering them how to become more effective at supporting and stepping in and assisting in the person's recovery. So let's talk briefly about what you can do. If you have a family member suffering an anxiety condition, one of these conditions, or a friend, you're not helpless. There are things that you can do to be valuable assistance in their recovery. So what's the recipe for success? Let's say 3 tablespoons wisdom, 1 cup love and support, 1 cup self-compassion, 6 cups of courage. Put those in the oven and you're going to have a successful recovery. So let me break that down a little further. Okay, wisdom. Well, one is helping the person understand that anxiety needs neutralizing actions to survive and thrive. We always want to be reminding our loved one of that fact, saying, hey, I can't make you not feel anxious, but is there anything we can do to neutralize less? Also, understanding anxiety loves speed. If you want to frustrate anxiety, change the speed. There have been many times through my careers I've had someone having a panic attack during one of my sessions. And one of the things I'll say offhand to them, say, hey, can you do us both a favor? I'm not going to say you're not allowed to panic during our session, but I'd really like you, can you panic 50% slower than you usually do? And the person looks a little confused at first, but they start to slow themselves down. And as they slow down, well, you can probably what happens. They feel less distress. They come through it. I didn't tell them don't feel anxious. No, they are feeling anxious. I'm going to go with that. But knowing that anxiety loves speed, I might ask them to slow down their panicking. If I'm working with someone who's washing their hands with OCD, they're washing them very fast. I might just encourage them, hey, hon, can can you just slow your hand washing down a little bit? Imagine you're 270 years old and have bad arthritis. Wash about that speed. And typically what happens, they actually wash less long and less thoroughly than they typically do because that anxiety is dissipating as they slow things down. Also, the wisdom that you don't have to hit the home run with an anxiety disorder. It's not as if a light bulb goes on one day and the person realizes that, oh, I will never be afraid of these triggers ever again. We want small, frequent victories. They're better than those infrequent, large ones. I mean, think about building fitness. And recovering from anxiety is a lot like getting in shape. Now, is it better to go to the gym one day a week for a 3-hour workout or to go 5 days a week for 20-minute workouts? Which do you think is going to build your fitness better? Yeah, those frequent small victories, they add up. They recalibrate the brain, they recalibrate the nervous system. So we always want to be looking for those frequent small victories. Now, if you can get those occasional, you know, large victories and the green light comes on, I'm all for that. But that's typically not my expectation, particularly early in treatment. We want to, if we put it in baseball terms, we want a lot of bunt singles. We want to get on base and move runners across. We don't want to be swinging for the fences early in the game. So love and support. Well, people will act more courageously when they know that those who love them understand how scared they feel. So let me share what this illustration is about. It's snakes in the bathtub. So imagine that there was something that you wanted more than anything else in the world, a new promotion, a new house. And we made a deal saying, okay, you can get that, but all you have to do is every day you have to lie down in a bathtub filled with snakes that are not poisonous, and you have to sit in that bathtub for an hour a day. Well, I don't know many of us who would be very excited about doing that. Even though we intellectually know they're not poisonous, what happens? We have that visceral reaction saying, ugh, that sounds awful. This is why we don't force people to do exposures. We don't, if someone has a germ phobia, I don't shove their hand on the doorknob. I invite them to, just like I would invite in that silly story, I would invite you to sit in the bathtub. I'm not going to push you in the bathtub because when we force someone to face their fears rather than inviting them and supporting them, there's something that we call white knuckling. And that means they just brace themselves through it. They don't learn anything. They just kind of grit their teeth and go through it and counting the seconds until the experience is over. We don't want white knuckling. We don't want to force them into the exposures. We want to invite them and support them. And that's something that can be very useful to remember because, and it's frustrating because we know that the key is if they can just neutralize less, but if we force them to neutralize less, that typically backfires because of this white knuckling phenomenon that doesn't allow the learning for them to happen. All they learn is that, well, I could do it when I was forced to do it, which doesn't teach them anything else other than, well, just avoid situations where you can be forced, which you can see a lot of treatment avoidance as a result of that. So self-compassion, one of the next ingredient. Anxiety loves shame. It's one of its best friends. Being fair to oneself and compassion are its foes. Now, compassion is not self-pity. Compassion is treating yourself in the same way you would a best friend. So as a family member, we can remind our loved one that it's not their fault that their brain's alarm system goes off so loudly. They probably did not line up pre-birth and said, okay, before I go down to earth, can I please have an autonomic nervous system that has false alarms and makes me feel so terribly? No, they didn't ask for this biology. They didn't ask for that. With support and encouragement, we can help them get out of that anxiety trap, out of the anxiety basement, but trying to do anything we can do to have them be more fair to themselves. Folks with anxiety, in my experience, tend to be very critical of themselves, very self-punitive. And it's that shame can just be paralyzing and make it hard for them to take that deep breath and do those courageous actions that will free them. So courage, one of the next ingredients. So courage is a skill that can be developed and strengthened through practice and repetition, camaraderie and support, and keeping focus on the greater good. So think about what the military does. They drill, they drill, they drill. Why do they do that? Because when the battle starts and the anxiety is happening, they want to have it down so innately, they don't have to think twice about what to do if their weapon jams. That practice and repetition, that's how we build courage. Camaraderie and support. Again, think of the military as an example. And the military is a place where they need courage in order for soldiers and sailors to be effective. They rely on the troop. The Marines will leave no one behind. This camaraderie, this support helps people face things that are scary, that feel dangerous, and also keeping focus on the greater good. Now, if you remember 9/11, that horrible tragedy, all those first responders, when they were interviewed afterwards, they were asked, weren't you scared when you went into the towers as they were falling? Every interview I saw, they admitted, oh, it was terrifying. And the interviewer would typically ask, well, then how did you get yourself to do it? And their answer was, well, as long as there was a chance to save a life, it was worth it. And so we want to help you find and help your loved one find, why is this worth doing this hard work? Recovering from anxiety is hard work. It's not comfortable. But why is it important to them? How can we have them tap into that courage of that greater good, the reason that makes sense for them to go through this discomfort in order to get better? So let's talk about a few things that you can do very specifically. Make time your ally. I alluded to that earlier. Slow things down. Don't coach them something they believe they can't do. So telling someone you need to calm down, a person who's anxious does not believe they have the capability to calm down, but communicate understanding and coach them to do something they can. Hey, I know you're super scared right now. We're identifying the emotion for them. We're letting them know we understand they're frightened. But please slow down your breathing and speak more softly so I can help. Oh, even when they're anxious, they can slow their breathing. They can speak more softly. They can become more emotionally regulated. They can do those things. Relabel the experience as the anxiety trying to push them around and team up with them against the anxiety. Hey, it sounds like the anxiety may be trying to force you to do what it wants right now. It doesn't have to be a battle between you and them. Have them become your ally. You become their ally against the anxiety. Invite them to problem solve. And not problem solve to how do I make you not be anxious, but something like, how can I help you give the anxiety less than what it wants right now? Again, remember the neutralizing. Person may have to neutralize it some, but maybe they don't have to neutralize as much as they usually do. And if they give it less than what it usually gets, that's a step towards recovery. And remember, your calmness is contagious. Our bodies pick up on the signals from each other. And if we're calm, that can help lower the anxiety for the person who we love, who's struggling in a spike. And if you need a timeout to manage your own anxiety, take one. I've learned that it won't help if I get angry or anxious right now. Honey, I need to take a minute to calm down and I'll be right back to help. It's also good modeling. It kind of gives them examples saying, okay, we sometimes taking a timeout, putting time on your side can be a great ally. So just a few reminders before we finish. One is resist providing too much verbal reassurance. And what I mean by verbal reassurance is not reassurance that, hey, if you neutralize less, the anxiety will go away. No, that's what we do want to remind them. But trying to tell them that the bad thing won't happen often doesn't help because we're just trying to predict the future too, and their anxiety won't really respond very well to that. Remember, the distress is speaking when they're mean, when they say they hate you. That's anger. And remember that the fight or flight, that's their distress. When their anxiety is up, I had a neuropsychologist colleague of mine who estimates in an anxiety spike, people lose probably about 15 to 25 IQ points temporarily. So the person is not thinking the way that they typically do. So help your little one rate their anxiety. Even just have them put in, okay, honey, you're anxious, scale of 1 to 10, how anxious are you? And maybe we can use a coping skill to bring it down a few numbers. Now, wait to process things until your loved one is calm. When a person's in an anxiety spike, it is not the time to get to the heart of the matter. They're not going to be able to process much. When a person's having an anxiety spike, the goal is to help them neutralize less. Let time be the ally. Let the body do what it knows to do. It knows how to get itself calm. We're trying to get out of its way so it can get there sooner. Take a deep breath and notice your own distress. Again, calmness is contagious. And remember that your loved one actually has to have some distress in order to get better. And what do I mean by that? Not purposeless distress, but they need to learn to experience the distress of anxiety with less and less neutralizing to learn that their body can process that anxiety, that distress on its own without having to do those neutralizing actions that have made it large and in charge. Well, I want to thank you for joining me today. I hope that some of the information that we have proves useful to you, proves useful to your loved ones, and I hope you're leaving here with some better knowledge and tools that you can use to move people that you care about towards recovery. Thank you.